You know, after Mitch was done with the work that you did for him, I decided it was my turn to come in, and I thought that the only problems I had were old fillings, and I knew I'd lost a few fillings that needed to be replaced, and so I was ready to sit down and be assessed and get that taken care of. But what happened?
Well, you know, obviously through our exam we determined that you had several broken teeth that were, you know, the fillings were still there, but the teeth had actually cracked around them, and that's one of the problems with old amalgam mercury-based fillings, is that these things can crack teeth. So, you know, when we realized that you had several broken teeth and you had a lot of other, you know, signs of, you know, TMJ issues, even though you didn't have really a lot of symptoms, it was just that, you know, you had notching on the sides of the teeth, extreme wear on the teeth, of course the cracks that we just mentioned. You had actually bone loss around certain teeth, and that was more from the bite issue. So we knew that there was a bite issue that was screaming at us. So we were able to discuss that with you and kind of let you know what was going on, because if you don't correct the underlying bite issue when we go to restore the teeth, it's still there. So the new restorations end up taking the same kind of forces. So we worry about how things are going to hold up for you long term. And naturally, if you're going to go through this, you want to go through it one time.
I was glad that you laid out options for us and explained the advantages and disadvantages of taking one segment at a time, or one quadrant at a time, versus doing it all at once, and that there was still damage that could be done if I did quadrant by quadrant. You know, long term it was going to be a problem. Of course, it took us a day or two to get back to you because I was in total shock
Sure.
about the problem that I had, but it didn't take long for it to sink in that it was genuinely the underlying problem that I never recognized.
Right.
And I've been really pleased.
Well, fantastic.
With the work.
Well, and that was the great thing, that you got such a beautiful smile, but it came from building a proper foundation through getting that perfect bite through the neuromuscular instrumentation that we use. So it ends up being something that looks beautiful, but it's also going to function well too at the same time.
I used to laugh like this.
Right.
Because I didn't want people to see those front teeth. I knew my front teeth were bad.
Now you get to show them off.
Now I'm getting lots of practice, lots of practice.
Fantastic.